The state's most vulnerable got their first dose of the vaccine today. Around 100 residents and 50 staff members were given the shot at Pioneer houses in Sacramento. Those who got them say they hope it's a step back to normal.
It'll be so nice to get back to regular routine and being able to see more people, you know. Right now, I'm hoping that I remember their names by the time I see these people that I haven't seen in 9 months.
Well, those inoculations are being done through a partnership with Walgreens and CVS. Operation Warp Speed, it seems to be in slow motion so far. Just 1% of California's population has been vaccinated.
So what's slowing down distribution and what's being done to try to speed things up? CBS 13's Renee Santos is live in downtown Sacramento getting answers for us tonight. Renee.
Yeah, people here at Pioneer House are now part of the state's population that has been vaccinated, but that's just a third of the doses given to the state. So what's the holdup? One reason we're learning this evening is deferring approaches to administering vaccines within the state's guidelines from healthcare providers.
It just feels so good.
Sharon Snyder has a new energy, feeling grateful to now be included in the state's small percentage of people to receive the COVID-19 vaccine. She still has one more dose to go, but says today is huge.
Truly a glint of hope in what has been a very, very dark time.
The latest numbers from the California Department of Public Health show the state currently has 1.3 million doses of the vaccine, but only a third of those have been administered. Another 600,000 still on the way. So why has the pace been slower than anticipated? And what's being done to speed it up? CBS 13 is getting answers. According to the state, there have been distribution challenges, and though the state has set guidelines to follow, how healthcare providers administer vaccines within those guidelines is up to them. Dr. Mark Galley says the state is talking with county health officials about how to speed up administering vaccines, which could include updated guidelines to expand availability to healthcare workers. And the sooner they're vaccinated, the sooner people in other tiers will get their shot in the arm. Cindy Mallory, who lives at Pioneer House, also received her first dose and says the state is doing what it can.
It's a process that nobody understands if you've never done it before. It's like all these little cogs that have to fit together. And if one cog is out of sync or if it disappears, everything is on hold.
Right now, the state is still in phase 1A, but the next phase will be phase 1B, which is also broken up, which can include education, people who work in education, as well as childcare.
All right, Renee, it came as no surprise a vaccine was coming, so it's real frustrating to see vaccines here and not given. Thank you.